Hello again. All right, so we're going to talk about erythrocyte disorders. So usually when we talk about a system, we like to talk about the normal, but also the abnormal, so things that go wrong. So we're going to focus on things that diseases that are associated with red blood cell disorders. So my pen started. All right, so probably the most common erythrocyte disorder is known as anemia. And anemia is really just a generic term, okay? So we're going to talk about all the different types of anemia, but all anemia means is you have an abnormally low oxygen carrying capacity, okay? So for whatever reason, you don't have enough oxygen circulating in your body, either due to not enough red blood cells or not enough hemoglobin. So any of those can be reasons, but we're going to talk about the specific types of anemia as we go forward. The thing about anemia is it's actually a sign instead of the disease itself. Okay, so there's symptoms and signs of anemia. If you're showing the signs and symptoms of anemia, that means there's an underlying cause of it, and we're going to talk about the different types of anemia. So when you say someone's anemic, a lot of times that doesn't give you the whole story. You got to figure out why they're anemic, what's the actual reason causing their anemia. And you can't stay anemic for very long. We have to have sufficient oxygen in our blood in order for our cells to maintain cellular respiration to make ATP. Okay, so you can't stay in a constant or prolonged state of anemia. You're going to have to do something to get you out of that state. Typically, people who are anemic are going to be fatigued. They're going to be tired, pallid. They're going to be pale. So a lot of our color comes from the redness of our blood. You're going to have shortness of breath. You may be cold. So those are very often signs of anemia. Some other signs and symptoms of anemia can be fatigue, so central nervous system problems like fatigue and dizziness. If it's in red, then we need to be worried about it. So fainting. You wouldn't want to faint while you're standing on the ladder or driving a car or something like that. So that's severe. You don't want to have severe anemia to the point that you're fainting. People that are anemic may have yellowing of the eyes. This has to do with jaundice, which has to do with a liver problem, which has to do with that bilirubin that we talked about earlier. Remember when you break down hemoglobin and one of the byproducts is bilirubin? Well, if your liver's not functioning and you don't get the bilirubin correctly, then your eyes and your skin can be jaundiced or yellow, so that can be a sign of anemia. Your skin could be cold and clammy and maybe partially yellow or pale. You could be short of breath, your respiratory system. So look at all these systems. Nervous system, integumentary system, respiratory system, muscular system. If you're fatigued, you're weak. Intestinal. You could have a change in stool color. Remember that bilirubin again. It turns into stercobilin, which gives your feces the color. So anemia could change your feces. Blood vessels. That's your also circulatory system. You could have low blood pressure. If you're anemic, you may have heart palpitations, you may have a rapid heart rate, you may have chest pain, angina, heart attack, and again, you may have problems with your spleen. So all of your organ systems can be affected if you have symptoms of anemia. So what are some causes of anemia? Well, one obvious cause is blood loss. I mean, if you're bleeding out, you're losing red blood cells, you'll become anemic. And so there's different ways to define that. Hemorrhagic anemia. This is going to be acute. That's when you get stabbed. So rapid blood loss. Think of traumatic injury. You've been stabbed by an axe or something. I don't know. So you have a large loss of blood. Okay. So usually you're going to need a transfusion. You go to the ER, go to the trauma unit, and they give you blood to replace the blood that you've lost. Well, first of all, they stop the bleeding and they hopefully sew you up, and then they give you a transfusion. Now, chronic, so this would be acute. So acute means short term, okay? The other one is chronic, all right? And so this means you're losing blood all the time, but it's not a very large amount, but over time it starts to present itself as a problem. And so this is a real common, like a bleeding ulcer or a hemorrhoid, which is a kind of a weak spot in a vessel. And so if you have internal bleeding that's going on over a long period of time, you're slowly losing blood, you may show signs of anemia. So that's you may even see blood in your stool. Maybe you may even see some of that in your stool as possibly a sign of colorectal cancer or something like that. But typically you can find the primary problem. You can figure out if it's an ulcer or whatever, a hemorrhoid, and then you can deal with that problem, stop the bleeding, and then everything will be okay. Another way to be anemic is you don't have enough red blood cells, so low red blood cell production. And so one of the forms of low red blood cell production is an iron deficiency anemia, and this can be caused by either hemorrhagic, so being stabbed, or a loss of blood in your intestines, a slow persistent bleed where you're basically sending iron right out your digestive system and getting rid of it. So you're not recycling it like you're supposed to, or you're not getting enough in. So maybe you're vegetarian. Real common in vegetarians, because vegetarians don't eat meat. If you eat meat, you're eating, especially like think about a cow, and so steak is red muscle. Well, it's got that redness because it's got blood in it, and that blood is going to have red blood cells, and that's going to have iron in it. So maybe you need to change your diet. Or maybe you've got something wrong. You have impaired absorption. So maybe your vitamins, your small intestine is not absorbing the iron and amino acids and things like it needs to in order for you to make red blood cells. Usually if you're anemic and you take the blood and look at it under a slide, if it's an iron deficiency anemia where you don't have enough iron to build your hemoglobin around, then the cells are going to be small, microcytic, and hypochromic. They look like donuts. They're instead of being thin in the middle, they look clear. So these are a real telltale sign of anemia is just looking at the blood smear. So all you do if you have iron deficiency anemia is just take an iron supplement. I usually give this to pregnant women anyway because they're building a lot of iron to help support their own blood volume as they get bigger, but also to help support the baby. So iron supplements are pretty common in pregnant women. And also girls, especially when they're during their adolescence and when they're having their period and they're bleeding, sometimes they become anemic, so you just change their diet, either make them eat meat, or not make them, but have them eat more meat. Even some leafy green vegetables can increase your iron in your diet, or just take an iron supplement. The problem with iron supplements is they give you constipation, so a lot of people don't like them. Another way to have low red blood cell production is called pernicious anemia. That just kind of sounds bad, doesn't it? Pernicious anemia. And it's an autoimmune disease, and what it does is it causes the destruction of the stomach mucosa. So the stomach is where the food first goes. It goes to the esophagus, into the stomach, and the stomach's a very acid environment, a lot of hydrochloric acid. So there's a lot of mucus that lines the stomach so that you don't digest your own stomach. Okay, but so maybe you have something that's destroying that mucosa, and what happens is essentially you lose the ability to absorb vitamin B12, okay, and because you don't make intrinsic factor anymore. And B12 is something that you have to have. Remember, we talked about DNA replication. In order for those committed cells to divide and replicate and make more and more cells, you've got to have B12 and folic acid. So you get these really large macrocytes that aren't very efficient at doing their job. Plus, they're big. They don't travel through the blood system very well. Easily fixed by giving the patient B12. Which is either an injection or just a nasal spray. It's really common as you get older. One of the things, your stomach mucosa naturally declines as you get older, and so people over 60 a lot of times get a B12 injection. It's also very common in vegetarians, okay, so they also have a tendency to become low in B12. So pernicious anemia can be an autoimmune disease. It can be a lack of intrinsic factor, again, because of that loss of B12. All right, so renal anemia. So remember, renal means kidney, and so you have a lack of erythropoietin. And so, again, someone that has renal disease, maybe they're in renal failure, they're on dialysis. If they don't have EPO, then they don't make enough red blood cells, and so you just give them synthetic EPO. So that's why we have synthetic EPO. It's not for blood doping. It's to help people with renal failure. Unfortunately, people use it in a way to cheat in athletics. Okay, another way to have low red blood cell production is aplastic anemia, And this is something that you've had destruction of the red marrow, and so if the bone marrow has been destroyed, then you can't make red blood cells. So this could be maybe you've had cancer, you've had chemical radiation or radiation therapy, chemotherapy, certain drugs, maybe a virus that can cause it. A lot of times we don't even know unless we know that you've been exposed to radiation or harmful chemicals. Otherwise, we may not even know. It could just be an unknown reason. The problem with aplastic anemia is if you have that, not only, remember that one cell that becomes all the other cells? All the cell lines are affected. So you have immunity problems, you have clotting problems, you have anemia, so everything that has to do with blood is affected. Short term, you give transfusions. Long term, you have to do a transplant. So a bone marrow transplant is what you would do for someone with aplastic anemia. So the opposite of low would be high. So what if you have high RBC destruction? So you had low RBC production, so not making enough. Excuse me. But now you're destroying them too fast. So you're getting rid of them faster than you need to. So one of those is called hemolytic. So lytic means to lyse or cut, so cut the red blood cells. So hemolytic anemias. And these are premature lysis of the red blood cells. And so, this can be caused by hemoglobin abnormalities. A lot of times this is genetic. Maybe a bad transfusion. Remember when you go to the hospital, they always do a blood type. And so that you can, if you're O positive, then somebody gives you O positive blood. There's a reason we're going to talk about later. If I'm O positive, why you don't give me AB negative blood? They don't get along very well, and we'll talk about that later. So maybe you've had an incompatible transfusion, and that's caused your cells to be destroyed, or an infection. Okay, so all of those can cause you to have too many red blood cells destroyed. Thalassemias. These are genetic, typically people from Mediterranean heritage. And so remember, hemoglobin has those 4 protein chains. So in thalassemias, they're missing one. Okay, or it's faulty, it doesn't work. And so because you don't have a fully formed, correctly formed hemoglobin, the red blood cells tend to be thin and delicate and deficient. And but it has different variations. So the severity totally depends on whether or not you're missing the chain or if it's faulty. So some people have the trait for thalassemia, but they're okay. But it can be very severe and debilitating and can cause severe problems. So many subtypes of thalassemias, but they're not all equal. It just depends on what the particular problem with that globin chain is. Another one, high red blood cell destruction, is sickle cell anemia. And so on this one you have something called hemoglobin S, where one of those beta chains is just one amino acid off. So if you remember, you take an amino acid plus an amino acid plus an amino acid, and that gives you those polypeptide proteins. And based on the way they're charged, that causes those globins to form those balls. Well, if one amino acid is slightly off, and maybe the charge is slightly off, you may get a slightly different shape. That's basically what's happening. And so with sickle cell, they have just that one mistake, or that one wrong chain, and it causes the RBCs to form these crescent, or sickle, these crescent shapes, okay? And so when they unload their oxygen, or when oxygen levels are low, the cells will sickle, okay? And well, these sickle cells, they don't go through the vessels very well. They tend to rupture and block real easily, clog up an area, so you get poor oxygen delivery. And they say in people that have sickle cell anemia, it's really painful as they become hypoxic and these cells sickle up. It causes a lot of pain. Okay. So where and who do we typically see with sickle cell anemia? It's genetic, and it kind of comes from Africa. And so you're going to see it in people with African descent, particularly people of color, dark black skinned people of African malarial belt descendants. Okay, so if you think about Africa, it looks kind of like that. So we're really not talking about the Mediterranean, not the Egypt and Libya. We're not really talking about that area. We're really talking about this malarial belt around the equator. Where the people have darker skin, they also have more subjected to mosquitoes, which carry malaria. And so the thing about sickle cell, well, malaria carried by mosquitoes, it kills about 1 million people per year. Okay, so it's a deadly disease. People use mosquito nets to try to prevent malaria, take anti-malarial drugs. But you're probably thinking, well, if you think about sickle cell, why would it have made it? I mean, if two people have sickle cell and they have a lot of pain, and a lot of times people with sickle cell will die early. How do they reproduce? How does this trait get carried on? Well, the thing is, if you have two copies, so remember so here's your mom and here's your dad, so when your sperm, and here's my sperm and egg, when they come together, you have two copies of every gene. You have your mom gene and your dad gene, and that makes you. Well, if you have two copies, one from your mom and one from your dad, so if your mom was a carrier, your dad was a carrier, and you got both, you have sickle cell anemia, you have full-blown sickle cell anemia, and probably not a great life expectancy, and you're going to have sickle cell, especially in Africa, in poor developed countries with not good health care. Here, we can treat it to some extent. Now, your mom and dad, or maybe you, so maybe your dad did not have it, but your mom had it, and so now you only have, let's make the little M circle means you have it. So now let's say your mom had it, your dad did not, and so now you just have one copy. We're going to talk about genetics a little bit later, so this is real simplistic for right now. But let's just say you just got the copy from your mom, but your dad's copy was normal. Well, you have the trait, but it's really mild, okay? And so the cells don't sickle as much as they do in someone that has two copies. But for some reason, if you have that trait, it allows you to survive malaria, okay? So being a carrier is actually advantageous if you live somewhere where there's malaria. That's why sickle cell is still around. So people who carry that trait tend to survive malaria. Of course, they pass on the trait. So that's how sometimes having a copy of something that seems bad is actually a good thing. So if you have sickle cell trait, it actually allows you have a better shot at surviving malaria. All right, some other erythrocyte disorders. Polycythemia vera. This is a type of bone marrow cancer where you get too many red blood cells. And so too many red blood cells is going to cause your blood to become very viscous, which can lead to problems with blood pressure and stroke and things like that. You can have secondary polycythemia, and this is what happens like when you have less oxygen, like at high altitude, and so you get that increase in EPO, so you get higher red blood cells. So it's not really a disorder; it's more of a reaction to keep you in homeostasis. Okay, so secondary polycythemia is what you get when you go to altitude. It's also what you get when you blood dope, when you give EPO to someone and they make too many red blood cells. Okay, so that's it for red blood cells. We'll continue talking about blood we'll talk about blood vessels and white blood cells as we move forward. Thank you very much.